to the latest ANCLAS public lecture in the long series that we've been doing for, what is it, 4 years now, I think, that they've been going. Before I get going with anything to do with tonight's event, just a couple of quick reminders of what we've got coming up. On April 16th in the Tank, we've got, I don't know if anyone knows about this, Professor Catherine Travis over in the School of Language Studies, is giving a public lecture called A Portrait of Spanish Speakers in Australia. And just to give a bit of context, before Catherine came to ANU, she was at the University of New Mexico, wasn't it? Doing a lot of work on diaspora changes in the Spanish language. So this is quite neat. How do things change as people move from one place to the other? So she's one of the sort of relatively new, I've just been here about a year, but relatively new additions to the whole ANU Latin American vibe. Then on April 23rd, the current, I guess, Chargé d'Affaires, the formal title, not ambassador, but functionally the same thing, of Paraguay, Esteban Bedoya is going to give the public presentation, the launch of the English version of his book. So in English, the title is The Apocalypse According to Benedict. Now Esteban's gotten rave reviews from no less authority than the Pro Vice Chancellor International here at ANU, who's been reading his work because, of course, as we know, Eric Lathander's got his professoriate comes out of the Argentine literature. So he's been quite enjoying this. So this should be, again, quite a treat to have that. And then the next one we've got is on May 9th, Manning Clark Theatre 4 again, so along here. And Raul Sanchez Uribarri from La Trobe University is going to come up and give us a talk on judicial loyalties, assessing the politicization of the Venezuelan legal system, which really could be in throes of interesting political events around that time too, depending what goes on the 14th of April. All right, and as usual, tonight when we're done, we retreat to the lobby to carry on discussion and lively debate with a little bit of extra lubrication. So you'll know that's coming. Right, now tonight, we're really lucky. We put a call out for postdoctoral fellows last year, about a year ago, and got a really quite astounding pool, and somehow we managed to pull 2 of them. So we've got Tracy here, and we've effectively got Zulika from the same hiring pool. So we've actually gotten really lucky, because we've pulled in Tracy Fenwick here, who is Canadian, as all Latin Americans in Australia seem to be, who did her DPhil at the University of Oxford at the Latin American Centre there, finished it at St. Anthony's College, and finished in 2009. She's got a master's in comparative politics and a BA in Latin American Studies and Economics from McGill University. She comes to us more or less directly from the Johnson Shoyoma Public Policy Graduate School at the University of Saskatchewan. And for those who don't know here, which probably is most people, Saskatchewan's kind of the breeding ground of all interesting things with public policy in Canada, like things like healthcare, welfare, all of that stuff seems to come out of Saskatchewan. And that fits a bit with what Tracy's going to be talking about now. In the past, she's been a visiting researcher at the Universidad de Buenos Aires, at the Universidade Federal de Bahia, at the Fundação Getúlio Vargas in Sao Paulo. 2003 to 2004, she was a young professional with the Canadian Foundation for the Americas. It's kind of like the Inter-American Dialogue, which unfortunately Focal has since died due to a lack of government funding, something I'm sure we can appreciate here studying Latin America and Australia. So we're very lucky to have her here as the postdoctoral fellow. More to the point, she's one of the world's leading experts on one of the hottest things in development right now. This is the hot topic. It is a massive area for AusAid. It is a huge thing which is being talked about in a number of African countries. It's a big thing, even percolating under the surface in the North American development agencies, which is conditional cash transfer programming. Tracy's 2009 article in Latin American Research Review, Avoiding Governors, the Success of Bolsa Familia, has become, it's a must-read piece. If you're going to write on conditional cash transfers, you have to cite this. It's only been out 3 years, and it's got over 60 sites so far, which is remarkably fast, because the publishing world in social sciences is at best slow. So it means a lot of people are using this very quickly. She's got other research that's come out on subnational authoritarianism and democratization in Latin America in the Journal of Politics in Latin America, and a forthcoming article in global social policy. And this is before we even get to her expertise in comparative federalism, which has had, ask her about it in the break at the end. She's got some interesting stories.
He's teasing me for a book.
Oh, yeah, definitely. 2. So without any further ado, what I'm going to do is I'll hand over to Tracy for debunking the myths about conditional cash transfers, and let's hear the truth.
Thank you, Sean. Welcome, everybody. Thanks for coming out on the eve of a public holiday. It's nice to see you all here. I hope I don't disappoint from what Sean set me up to be. Yes. So, if it's okay with you, can we take questions at the end? I'm going to go over some myths. I have chosen to structure this talk around myths because CCTs have become such a hot topic with a lot of hype surrounding them. I am trained as a comparative political scientist, so I hope that it's okay with you guys and that you understand that I'm not going to do a true false. Most of my myths, there's some part truth and some part untruth, so it won't be crystal clear. Yes, so I just would like to know if everybody already knows what CCTs are. Everybody's pretty familiar with them. Okay, I will define them anyways. CCTs it's a social program. It's become the preferred policy instrument to alleviate poverty in the developing world. CCTs deliver a small amount of cash directly to a socially vulnerable family that falls beneath a threshold normally set by a program. That threshold changes depending on what country you're looking at. And this direct cash transfer is given to a family in exchange for the fulfillment of conditions. These conditions are linked to human development objectives. Normally they're linked to education, health, and nutrition. The idea from a development perspective behind CCTs is really one of co-responsibility. So the idea of entitlement with individual responsibility. However, there is some myth surrounding them. And the first myth I'm going to talk about is the origins of CCTs. Just to put in context, I don't think I'm as big as an expert as Sean set me out to be, but I've been working on CCTs for a decade. And when I started working on CCTs in 2004, the first response to me was, how can you write a dissertation on just one small social program? For those of you that know, if you put in Bolsa Familia in Google now, you come up with about 10,000 hits. So the origins of CCTs, where do they come from? I'm going to state at the outset that CCTs as a policy instrument are indigenous to Latin America. They come out of Latin America, and the reason that we can say clearly that the policy instrument comes out of Latin America is that the two first national programs in Brazil and Mexico were designed without financing or backing of any international development bank. So this goes to the next myth, which CCTs are Brazilian, which is not entirely a myth, but is not entirely true. There's two parallel ideas circulating amongst knowledge communities in Brazil around the same time. This is within Brazil, so in the 1980s and the 1990s. The first idea comes out of Brasilia, and you can date it back really to a paper written by Cristóvão Buarque in 1987 called A New Agenda for Brazil. And Buarque conceives in this paper of an idea to deliver cash transfers to socially vulnerable families in Brazil in exchange for a condition based on education. So the prime objective of Buarque's first program that he developed coming out of this paper was really about education. The focus was on education. How do we stop people from dropping out of school? For those of you that are Brazilian know that Buarque becomes governor of Brasilia in 1995. He launches the first program at the subnational level in Brazil, a concrete program called Bolsa Escola in 1995, and as I said, it's tied uniquely to education. This program is very successful. It gets a lot of international attention. It's evaluated by UNESCO, UNICEF. Fernando Henrique Cardoso, he's elected in his second term in 2001 he makes Bolsa Escola national. Prior to it being national, there's a diffusion process of subnational programs like the Bolsa Escola in Brasilia that start diffusing throughout Brazil. So by about 2001, there's over 200 Bolsa Escolas in different municipalities and states in Brazil. At that time, in Cardoso's first term, the federal government, they are part financing those subnational CCTs, which is also part of the diffusion process. So the federal government basically says we'll pay 50% of the cost to any subnational government or city that wants to implement this program. So as they start getting more successful, the momentum goes. Brazil makes it a national program in 2001. It's tied to education, it's controlled by the Ministry of Education, and it peaks in 2002 at about 5.3 million families. And that's when Bolsa Escola peaks. There's another group of intellects in Brazil that are developing similar ideas, and you can even date that back to the late 1970s. They tend to be left-leaning progressive economists, and they're working also on an idea of alleviating poverty and improving on inequality in Brazil using the idea of renda minima. So these are cash transfers which are tied uniquely to social rights of citizenship. They have more of a focus on the individual than the family. The economists involved in this are people like Mangabeira Unger, Bashmar, Edmar Basha, José Camargo, who else? Lots of people. Pais de Barro, Eduardo Suplicy. This is his lifelong passion. So these economists are really working on the same idea, but from a little bit of a different perspective, still within Brazil. Exactly the same time as Bolsa Escola gets implemented in Brasilia, the first renda minima program is implemented in a city outside of Sao Paulo called Campinas, under Mayor Teixeira. So the first two programs as concrete policies are really experimented at the subnational level in Brazil, and it's 1995. The next myth is that CCTs are Mexican. So if you're Brazilian, they're Brazilian. If you're Mexican, they're Mexican. I'm neither, so I can talk about them like this. CCTs are Mexican. That belief is because you have an entire different group of policy entrepreneurs and intellects working on the same idea in Mexico at pretty well the same time. A little bit different group of people. Is there any Mexicans here? There's one. I have a picture of Salinas here. A lot of people criticize one aspect of my work, which is why in Mexico I go as far as back as Salinas. President Salinas started a program which has been lost its notoriety. It's been defamed. It was called Solidaridad Pronasol. This was a program that has been heavily linked to pre-patronage. However, why this program matters is that there is some parallels in this program to the idea behind CCTs, and I have talked to Salinas about this, and he doesn't either answer directly, he just kind of shrugs his shoulders. But Pronasol came out in 1988. It was a very powerful federal government program that delivered cash not to families, not to individuals, but to communities, in exchange for community projects which were focusing on investing in infrastructure. The idea, there's two reasons why I go back as far as Salinas when I look at the history of CCTs in Mexico, and that's because this program was a federal government initiative that was delivered straight to municipalities, which was quite uncommon in Mexico at the time. And then when Zedillo made Progresa, which is the next program I'm going to talk about, which was Mexico's first national CCT linked to human development objectives, it goes back to going through the states. So anyways, there's another big reason why we tie Salinas into these ideas. The first paper in Mexico that comes out with a policy proposal which looks today like a CCT, the way they're being implemented today, is in 1991, and it's by the economist Santiago Levy. And Santiago Levy in 1991 publishes a very important paper similar to Boarqui's, and it's called a proposal. It's called "Extreme Poverty in Mexico: A Policy Proposal." Santiago Levy was one of the chief designers of Pronasol under Salinas. He becomes the director of the National Institute of Social Security, IMSS, and he also he's the main architect of Progresa, which is Mexico's first national CCT, which becomes Oportunidades. He also is the architect of that one. Santiago Levy goes on to be the vice president of the IDB, and he's still involved in the IDB. So the idea of CCTs as a policy instrument is indigenous to Latin America. There's parts of it that can be claimed by Brazil, the subnational experimentation. The part that Mexico can claim credit to, which is now recognized, and there is a consensus in the literature, is the idea of an integrated approach. So Levy's idea was really based on the idea that to alleviate poverty, you couldn't just focus on education and school attendance. You had to take into fact nutrition and health. And so Mexico, 5 years before Lula's very famous Bolsa Familia, which because of its sheer size and success is what most people link to, is why people link CCT specifically to Brazil. The idea of really this integrated, holistic approach really comes out of Santiago Levy's work. So this goes to the last myth, and this is, I'm afraid, still about the origins, which you can get a bit obsessive about. If you do social network analysis, you can locate all of these names I've mentioned around Boston in the late 1970s, early 1980s. They all hung out. They all went to coffee together. So you can get a bit obsessive about tracing back who knew who and what they were talking about. The last myth about the origins of CCTs I see very frequently and more in the literature, which is the idea that CCTs are the policy instrument of the World Bank. Neoliberal idea created by the bank. I see it in so many articles lately. This is a myth, but it has certain truth to it. And it's Fernando Henrique Cardoso who recently said in a televised interview, because in Brazil, the reason why there's such a debate about whose idea it was, which political party created it, was because they have a lot of political power, and there's a whole other debate surrounding why it matters who can claim ownership to it. And so Cardoso recently said in an interview, it wasn't my idea, it wasn't Lula's, it was the bank's. The certain truth to that is that there was an ideological change in the World Bank following the failure of the Washington Consensus, that the only way, the magic wand, growth wasn't going to trickle down, the social consequences in Latin America following the lost decade of the 1980s meant that the bank created a new agenda for poverty. They developed a new two-pronged approach to social protection, which was the idea of creating a means-tested, targeted social policy to alleviate poverty, which was tied to investments in human capital. So there's an ideational change in the bank that's happening around the same time that these ideas are being developed in Latin America. For me personally, I find the easiest way to kind of filter out all of this is to basically, there's an ideational process happening at the international level in development discourses, and that is that this motivates Latin American policy entrepreneurs to start thinking about specific instruments which they can develop. Santiago Levy, Unger, a lot of these people have also worked for the IDB and the World Bank, so there's a lot of play in a lot of the people working in the bank at that time on the new agenda for poverty also are Latin American intellects. So really there's, from an ideational perspective, there's the international level, but really the policy instrument, the idea, the first experimentation subnational in Brazil, and national in Mexico. This goes to another myth, which I call that CCTs are the first step towards an ongoing agenda to reduce poverty. And again, this has to do, I would say, more uniquely with the group of economists and the intellects coming out of Brazil that had more of a left-leaning focus dealing with CCTs. So the idea here is simply that are CCTs a means to an end or an end in itself? People from the left that embraced the ideas of CCTs, some of them did it begrudgingly, and this is more a domestic debate. People that work in social policy within Latin America in a domestic circle do not really like CCTs. And the reason is that they were embraced from people from the left because it was considered to be a means to an end. They were just going to be one step. They were going to be complemented by other initiatives. There was going to be other programs that were going to be linked to them. It wasn't just going to be an end in itself. What happens is that the World Bank and the IDB and international financial institutions, they love CCTs for a few really simple reasons. They're performance gauged. You can easily assess who's doing, how the performance is. Is it reducing poverty? You can measure it, so they're empirical. So the basic idea is you identify the poor. Once you've identified it, you can solve poverty because you identify them, and then the solution is that you directly transfer money to them. So problem solved. So from a neoliberal perspective, this idea of CCTs was and is embraced by people of a broad ideological spectrum. The chief difference, I think, is that people who embrace it from the right see them as an end in itself, and people that embrace them from the left, specifically when you speak to economists like Suplicy and people who have been involved with them for over 20, 30 years, there's really a bit of a disappointment about the fact that they weren't the first step. They became an end in themselves. So, and then I don't have a graph for you here, but if you also look at a graph, the amount of social spending, specifically when you put it in social assistance that CCTs represent, over time increases. So they're really crowding out other social protection initiatives, which is also why they are becoming more an end in themselves and not a means to an end. So, myth 3, CCTs can reduce poverty. I'm happy to say to everybody, this is not a myth. CCTs reduce poverty, and they do it well. So I've chosen to show you Brazil. This is a report that was came out of IPEA and GV in Brazil. And basically what this is showing is that these are the two drops in poverty in Brazil. And then basically the first one that happens under Cardoso's first term has to do with controlling inflation and macroeconomic stability. And then the second drop, which you see really when Bolsa Família is launched in 2003. So Lula in 2003, when he becomes president, he takes Bolsa Escola, he transforms it into an integrated approach like Mexico, which is no longer just focused on education. It's no longer housed under the Ministry of Education. It's created under Ministry of Social Development, a specific program office, and it integrates health, education, and nutrition all together. And then it's expanded, and the coverage is greatly expanded. So today you have it going to 13.5 million families. So it approximately affects or impacts in direct or indirect ways about 25% of the entire Brazilian population. And so it does in Oportunidades in Mexico. The numbers are about the same at affecting about 25% of the total population. And so there's been a lot of research done, as you can all imagine, a lot of very sophisticated empirical evaluations as to whether conditional cash transfers really reduce poverty, and we know they do. So this drop here is called the Bolsa effect. That drops poverty. What's interesting about the research coming out of Brazil now, that it's actually been shown that Bolsa Familia probably had a greater effect on reducing inequality than it did poverty. And this is coming out really, it's also coming out of IPEA, which is the Brazilian Institute of Applied Economics. And so it's seen that about the drop in inequality in Brazil, about 18% of it is related to Bolsa Familia, whereas actual absolute reductions in poverty, it's only about 5%. There's a non-intended effect of Bolsa Familia that's not often talked about in the literature, and it's on consumption. It was an unintended effect. And basically, it principally comes out of the research of Rosa Marques, and Argelina Figueiredo has also done some survey research on it. And what it's looking at is the non-intended effect of Bolsa Familia, besides just reducing poverty, was that in small municipalities, and particularly rural areas, in areas where you almost, there was not a lot of disposable cash floating around. I'll give you an example. In a municipality called Vitória de Santo Antão in Pernambuco, 43% of the municipality's disposable income is just coming from Bolsa Familia. In the city of Sao Paulo, and this was Figueiredo and Bircher and Torres' work, which was also came from survey research, they found that in 2006, 14% of the families receiving cash transfers in the city of Sao Paulo, that represented 100% of their total income. So what this means is this non-intended effect of Bolsa Familia means that you've got small cash inputs going into communities, which then leads to small examples of kind of microeconomy. So you have, all of a sudden people being able to sell juice and other things, and women being able to sew clothes, and you see small businesses. And so basically these small inputs of cash really do have an effect on kind of revitalizing really microeconomic opportunities in some of these small areas. As I said, this is a non-intended effect of Bolsa Familia. In Mexico, I couldn't tell you why, but they haven't found the same increase in consumption within those communities. So this is really important. CCTs are supposed to reduce poverty through cash transfers, and they do it. We know they do it. Through the conditions that are attached to CCTs, they're supposed to halt the intergenerational transmission of poverty. What this means is it's supposed to prevent people from falling into a long-term poverty trap. It's supposed to prevent children and grandchildren from falling into that poverty trap. And this is because it's tied to conditions which are related to human capital investments like school attendance, vaccinations, maternal nutrition, et cetera, et cetera. This is a myth, and I'm going to put myself on the line, and I'm going to create controversy, and we can discuss it afterwards. It's not just me that thinks it's a myth. There's a few reasons why I say this is a myth. There's not been enough time to really evaluate empirically whether CCTs have any long-term effects on poverty in the developing world. There just hasn't been enough time. That's the first reason. The second reason is that there is empirical information that CCTs, because they're conditional on school attendance, have increased school attendance. In Mexico, there's clear empirical information that they prevent teenage girls from dropping out of secondary school. There is information in Mexico, and Mexico has been heavily monitored by the International Food Institute, which they brought in very early days. Empirical information saying that CCTs have improved, there is decreases in infant mortality. There is increases in Mexico, specifically within vaccinations and maternal nutrition. Again, you go to Brazil, what the big problem in Brazil is that following the 1988 Constitution, and because of programs in health like SUS, Sistema Único da Saúde, and Fundacef, access in Brazil to basic health and education was already universal. So it is very difficult to show in Brazil whether there has been increases in school attendance and more in the health. In Mexico, there is clear information about this. Again, the problem is school attendance doesn't equate to educational attainment. So going to school and your mother in return getting a benefit because you attended school and because somebody ticked the box says nothing about the quality of educational institutions or the quality of the health care you're receiving. And in Brazil, it doesn't say that you wouldn't have vaccinated your children if you didn't get Bolsa Familia, because you have access to vaccinating your children. In Mexico, again, 44% of the people in Mexico that receive Oportunidades are indigenous, and Oportunidades was originally created with an extreme poverty focus in rural areas. It didn't go into urban areas till 2002. So we see clear positive outcomes in Mexico with things like nutrition. Again, does this halt the intergenerational transmission of poverty? This is my favorite myth. I have a gender bias with this one, I'll admit. For those of you that don't speak Portuguese, this gentleman here is saying Bolsa Familia is going to pay us 65 more reais a month if we have 5 children. And his wife, and he says to his wife, come on, leave the children in the living room, let's go to the bedroom and we'll increase our budget. I don't want to be too critical of the World Bank, but it is amazing on an international development discourse level how many times you will hear over and over and over again that CCTs empower women. The reason they claim that CCTs empower women is that the monetary amount of CCTs are allocated to female heads of households. The myth is that this empowers women because it provides them with economic autonomy and it increases their presence in decision-making arenas within the house. CCTs are child-centered. CCTs are focused on children. CCTs are focused on children attending school and children having better outcomes and children being better equipped for the future. CCTs are not about empowering women. Because CCTs are focused on children and the monetary amount is delivered to women, it's intuitive that what this does is that it puts women as the intermediary. Women are in the middle. Women become responsible for the empirical outcomes of CCTs in Latin America. Women have to make sure, so women lose domestic labor at home because their children have to attend school. So specifically, again, you look at in rural areas, teenage girls that would normally stay home and help mom out now have to go to school. I'm not saying this is a bad thing, but women lose their children's assistance at home. They then have conditions that they have to attend healthcare appointments, sometimes in quite distance away, 2 times a month. They have to make sure their children go to school every day, because if son doesn't attend school, and you can see this in surveys, you can see it in all kinds of research. You know, I kept telling them they had to go to school. He didn't go to school 4 times. I got kicked out of the program. You're talking about a family that's relying on this benefit, say for 100% of their income. So women really become this factor that's responsible for children meeting these conditions, and they're responsible for really the ones that make it happen. So the problem with this, and you can, if anybody's interested in this, you can read Maxine Molineux's research on this, and she has a quote from a rural Mexican woman that says quite simply, "The government says they're helping me out, all they're doing is giving me a lot of work." Why does this matter? This matters because it institutionalizes a traditional paternal sentiment within social policy traditionally in Latin America that women are responsible for the care of children and their future well-being, and it is not shared at all. In its easiest way, Bolsa Familia pays women to stay home and care and be responsible for their children. This is a historically prescribed role. And although, as I said, there's nothing wrong with the fact that CCTs are child-centered and that is part of halting the intergenerational transmission of poverty, it is wrong to advertise and sell that this empowers women. So what CCTs do is it enhances the status of women within the household. It does not empower women outside the household. I've even seen interviews of women that say, and I have seen this in my own experience, there's a lot of paperwork attached to Bolsa Familia. Many of the mothers that are receiving it are illiterate. They have to get other people to do the paperwork. And a lot of these women have said that although Bolsa Familia is great, they would have preferred to learn how to read, and that probably would have enabled them to teach their children to read. So you're completely forgetting about women by going over them and making them responsible for this. Next myth about the effects. This is a big one. CCTs buy votes. This is a very, very bad graph I have taken from Folia. I'm just going to explain simply what I'm trying to say. The hypothesis that CCTs buy votes also came about in Brazil more strongly than it did in Mexico for the following reason. Lula is from the PT party, the Workers' Party in Brazil. So Lula's regional support in 2002 is in red. In 2006, Bolsa Familia gets implemented in 2003. His regional support is in the northeast and the north of Brazil, which are the most impoverished and socially vulnerable areas of Brazil. I think this is a myth. What I'm trying to show you here is why this myth has dominated the literature since 2006. It's dominated the literature since 2006 because when political scientists see this, they get really excited. There's something wrong. This is a massive shift in voting behavior, and this electoral shift makes everybody go, something's happening here. So the hypothesis which, and this is a lot of political scientists and a lot of resources that have gone into establishing whether or not this is true. And as I said, it was because it created a direct polarization in the fact that in 2006 it was seen that the people that were supporting Lula came from the lower income brackets. And these shifts represent a historical shift in electoral patterns in Brazil. The problem is that there is a geographical bias in Bolsa Familia because these areas are where most of the people that are eligible for Bolsa Familia live. However, the problem with this hypothesis is that, and I will quote what one of the first papers claimed it was, if this is an unfolding of the old story of using the government to build clientelistic support in the Northeast, then you would have to find evidence that targeting in the Northeast exceeded the predetermined goals of the program. Now, if you want to do this today, Brazil is a beautiful place to research because all the data is electronic. You can get a list of every family receiving Bolsa Familia. You can download the spreadsheets. When I started working on this, you couldn't. I spent 3 years trying to see whether the targeting was overshooting the predetermined goals. So you would take municipalities and states and see levels of poverty, calculate, because it's dependent on bottom-up implementation, to really see whether the targeting was off, and it wasn't off. Another reason why this hypothesis, I'm surprised that it's lasted for 6 years and it lasts, is because now the World Bank and the IDB and these institutions, they do fund and finance the implementation of CCTs. And because everybody is very cautious of this history of vote buying in Latin America and buying the poor's vote, they are so monitored. They are so transparent. As I said, you can just download the families. If you wanted to do a survey, you can download the 13.7 million families in Brazil that have it, and you can go knock on every one of their door, and you can ask them if they only receive Bolsa Familia in exchange for voting for a specific person. So this debate continues. There is a policy feedback effect from Bolsa Familia, which we can't deny. It led to, and this is a new policy feedback effect in the sense, again, it's not like traditional clientelism. It's not an interest group that was formed. It's a mass constituency. It's 13.7 million people. So the new idea is that there is very feasibly a policy feedback effect.
It's families, right?
Yes.
13 million families.
13.7 million families, so
Not
the average family's 4, so it comes out at about 44 million
Right, yeah.
people if you were looking at it like population size. So yeah, so it creates a mass constituency, and there is new research that this mass constituency will affect electoral behavior, and the most common indicator we use to look at this is voter turnout. Bolsa Familia increased voter turnout in the northeast of Brazil. It increased political participation of families that were in the 0 to in the lower, below 3 minimum wages. But that's not vote buying. That debate is alive and well, and it's almost a war. So this myth has not been resolved at all. This is my last one. This is probably more closely related to my own personal research, and it is that CCTs can be implemented anywhere. And I put up a map of India because anybody in development studies or that reads The Economist will see that the next big CCT experiment, which the bank is backing, is in India. In contrast to international policy prescriptions, domestic institutions still matter. The success of Bolsa Familia in Brazil and also in Mexico follows a clear federal logic. Because most Latin American countries are decentralized, the national government may be designing and financing and giving the cash, but the conditionality part of it is normally under the jurisdiction of subnational governments. So you still have to have political will. You still have to have popular support. You have to have a bureaucracy that has to work pretty well. I look in the early days of Bolsa Familia in 2006, the Ministry of Social Development had a date that they had to cut off signing people onto the central registry because of the upcoming election. So they had a cutoff date. Prior to that cutoff date, they were putting in 44,000 in Brasilia, 44,000 families a day into the central database when Bolsa Familia was building up to its target. So you need a bureaucracy. Brazil also has the advantage, which came out of the original Bolsa Escola program, that it has, the cash is delivered through electronic bank cards. Most of these bank machines are located through the Brazilian postal system. So there's a whole bunch of institutional factors that still matter for the successful implementation of CCTs. There's also a feedback. For any of you that study policy, Brazil and Mexico from Pronasol, which was the infamous patronage Salinas program I described, had very negative feedbacks, which also complemented and contributed to the success of Progreso and Oportunidades, again, the political will and the popular support. The positive feedback effects of Bolsa Escola and the subnational experimentation in Brazil meant that Brazil was ready to go to a national program. It was ideologically embraced. It's now no longer, these programs are no longer vulnerable to partisan change in Latin America. Oportunidades hasn't even changed names from the PAN to the PRI. I don't think it will. I don't foresee, but again, this is pure conjecture, that the name Bolsa Familia, or that Bolsa Familia in the last election, there was no evidence that anybody would have altered or touched it in any significant way. Why I talk about policy feedbacks is that in my own research, I've looked at CCTs in Argentina. They haven't had the same success because there is existing policies that existed beforehand which haven't contributed to the implementation of this kind of CCT, which is modeled from the Brazil and Mexican experience. I'm not going to start talking about India because it's out of my area, but you can quickly identify in the literature that the idea of a CCT in Mexico is supposed to all of a sudden replace decades of previous policies and programs which have existed. Again, so policy feedbacks are that those previous programs had their own interest groups, their own logic. It's very difficult to erase that. Mexico and Brazil didn't have to. So that's it. So thank you very much for listening to my presentation. When we see poverty reduction in Brazil, it's empirically established that this level of poverty is related, this first drop in poverty comes down because of this macroeconomic stability and the success of lowering the inflation. And so then the argument is that once inflation was lowered in Brazil, which they did very well, starting in about 1995, under the Real plan, that this is called the Real effect. So this is the effect of inflation coming down. But then what happens is you can't get poverty down again. So macroeconomic stabilization brings it down, but then the problem was that the economic tripling down with growth wasn't having a greater effect on poverty reduction. So then you come out with the idea of conditional cash transfer programs distributing cash, and you get the second drop. Coming specifically from those programs. But there is people here like Carlos that are probably far more qualified to talk about macroeconomic stability than I am. No, and that the new research coming out now would show that if you look at the people from 2001 to 2006 that came out of poverty in Brazil, Bolsa Familia only had contributed to 5%. So that's again where it gets really difficult to crowd out all the other factors. So there was increases in minimum wage. There was an export commodity boom. Brazil had high levels of, their growth rates were quite high and sustained over this period. The answer to that would really also again be over time. What's going to happen when the growth rates in Brazil go down or sustain? Like, will the poverty and inequality continue to come down even when the other economic factors maybe we can control for better because they change? At the moment though, and as I said, there's quite sophisticated research coming out that the effect of Bolsa Familia on reducing absolute poverty has been around 5%, but on inequality it's about 18. So it had a greater effect on narrowing the gap than it did on actually reducing people below the level. But no, there's a whole other factors. It's not just a subsidy. And again, the central message here, and I know that this message it's starting to appear more and more in the literature, but really is this idea about, CCTs being the silver bullet, and the doubts around that. And just one comment I wanted to make about the conditions, and I did a lot of field work with a lot of mayors, and sat in a lot of, also with more the left-leaning Reine Minima crowd that don't believe in conditions for the reason you said, that it's somewhat stigmatizing. It's saying that, the poor aren't capable of deciding how to spend their money, and to make sure they don't spend it on something we don't agree. And their argument is if they want to buy a TV, that's none of anybody's business. That's not something to control. I'm Canadian. In Canada, we have every child in Canada, we have a universal program. You receive $100 a month, whether you're wealthy or not. It's a small amount of GDP, I didn't mention, but these programs are very cost effective. They only represent about 0.5% of GDP. What interestingly comes up in the field research when you talk to people, especially in Argentina, is that it's the international factor that demands the conditions. You'll meet a lot of people. You'll meet a lot of people in NGOs and at the local level that will say, you'll meet a lot of people in Brazil at a high up level that really their emphasis on conditions is really that the bank, I asked somebody in Argentina, but what about the conditions? You don't even have the healthcare facilities and the educational and the schools in order to have all of these children all of a sudden come into it. Why do you have conditions when you can't even really, in terms of quality, fulfill them? And he will say, he looked at me straight up and he says, because if not, the bank won't fund it.
Exactly.
So
the terms of the loan.
It's a huge, that goes into a whole, the international development discourse, but.
And I guess the argument that we're also trying to raise is by making it universal, you buy in the vote of the middle class as well. And often that's the argument is that the more likely they can see the benefit for themselves, they're more likely to support the program, and it's more likely to be sustainable. But it's poverty targeted, often the very poor are the largest vote buying group in the community, and their voices aren't as heard as, say, the middle class.
Yeah, and so far as we've seen also, as you said, again, going back to the myth, CCTs reduce poverty. So whether you had the conditions or not, the part that we know is working would continue to work. It's the part we're not sure is working that's linked to the conditions. So there's a lot of survey data that's coming out of Brazil. So far, most of it, the questions that have been asked, nobody's been super happy with, and that they don't go to that depth you're looking at. There's more research like that comes out, I would say, more the southern states of Mexico, where you have high levels of indigenous. And there again, Oportunidades in Mexico, because it was focused on extreme poverty, and it was originally rural. You could only get it if you lived in a rural area. And also, they did pilot programs, and they chose certain states in Chiapas and certain areas where they specifically just put it in. I think there you would find more research that it was affecting, again, there was educational components in getting indigenous children to school. There was programs tied to, there's special programs for women who are pregnant and have children from 0 to 2. They also are still giving out actual food baskets, and there's a food component to women who are pregnant. And so there's definitely more. Again, Mexico always had their CCTs, which also, it's amazing how much people don't talk about them anymore. It traditionally was the gold standard of CCTs, and it was far more holistic in specifically what they were trying to achieve, and that there was complementary programs tied to Oportunidades that were trying to achieve that, and it was much more focused in specific context. So, but in terms of specific research, maybe in some of Maxime Moulineau's work out of ILAS, the Institute of Latin America, tied to the University of London, in her work, in her survey research with women, you might find some questions related to that.
Okay.
I think it had to do with the fact if you actually look, if you look at the numbers, actually, and Mexico does well at extreme poverty, oportunidades. Bolsa Familia doesn't. Bolsa Familia, the most extreme poor in Brazil are still not getting Bolsa Familia. When you look at the PNAD, which is the domestic household, sorry, I'm not translating PNAD very well, the household.
National Households Survey.
Thank you. They're doing the biggest the biggest outcome that they've gotten out of their research is that the most poor in Brazil, the extremist poor, aren't getting it. So it would have affected inequality more because if you look at the minimum salaries, about the bulk of the recipients of Bolsa Familia, they're really in the 1 to 3 minimum wage bracket already. They're not below, definitely not below 1. That's a problem which is talked about a lot within, again, a domestic policy circle about how to, and there's no easy solution. There is no, like, how could Bolsa Familia, because Bolsa Familia is, you self-identify, so it's normally through schools and, you have to know about it. So again, if you look in some of the socially vulnerable areas, even in the city of Sao Paulo, the people on the very fringes and the most violent areas, they don't have Bolsa Familia. You see it in public opinion surveys. The fact that Bolsa Familia and that experimentation comes out of the subnational level, it also comes out of a very unique historical time. Like it's developed between 1988 and 1995. So it comes out of a time when decentralization's gone so extreme that you've got cities that just have got problems they don't know how to deal with. For the Brazilians in the room, I know you can talk about it better than I can, but the kind of chaos, the lack of services, nobody knew who was delivering what. There was kind of a gap. Somebody had to do something. So you again have policy entrepreneurs that come up with these ideas. The renda mínima, the circle of people that work on basic income in Brazil and have always worked on that idea, that are close to the PT, that consider conditional cash transfers as something that should go to the individual, not the family, and should be unconditional. That's also very strong in Brazil. It's not a voice of the right at all that other countries don't have. So when you look at, again, what I meant about popular support, the popular support for Bolsa Familia is really high. It doesn't matter whether you're the wealthy. If you look at the numbers, they're staggeringly high, which is also why the whole debates about which party owns it and who came up with it are really irrelevant, because they're embraced across the ideological spectrum. I'm used to going to call it. You made me lose my point. But so in Brazil, you have a different experience. In Mexico, where you didn't self-identify, it was a top-down implementation process. It had an indigenous factor to it, and it had a rural factor. There is stigmatization. It's very recorded. In small rural areas, there is a fear that people who get it almost don't want to get it because you're stigmatized within the community, because it's also extreme poverty, so you have to be extremely poor. In that way, it's more effective, whereas the Brazilian one with extreme poverty isn't as effective. But the Brazilian one, you don't see the stigmatization effect, whereas in Mexico, it's very documented that you have women that don't want anyone to know. You don't want the other ladies in the neighborhood to know that you're getting it and they're not, because the community becomes divided between who gets it and who doesn't, and it is a big issue. Definitely, the vote buying myth it's a very political science debate, but I do think you're right, and I'm already seeing it now. It's definitely decreasing over time, and I think also why it'll decrease is that, again, it's this idea that any government that comes up with a new policy which affects a mass constituency, there will be when they first implement it, there will be, if it's successful, there will be an electoral effect, which is not necessarily like traditional corporatism in Latin America. But that over time, because these programs are not vulnerable to partisan swings and they will stay around for the long time, I think we'll see, and I think in Mexico you've seen that you see that the shift in voting, it's not, you can't research it so much anymore. What I was trying to say about Brazil, it was specifically this election and this time that created all of these hypotheses, specifically because the electoral shift was so great, but it was also so changing historical patterns of voting.
And how do you measure poverty, the reduction of poverty in the line?
The way it's used to see, that's not a multidimensional.
Okay.
It's a monetary, absolute poverty for all of these things is still, Mexico has a multidimensional, every country has different ones, but it's still a monetary. There's discussions about whether IPEA is going to bring in regional poverty lines, which would change a lot of the figures, but also Bolsa Family is not indexed to different regions. Mexico, Oportunidades is indexed. It makes a big difference. So in Brazil, what you see is because it's not indexed, if you live in Sao Paulo, that amount of money has it goes a lot, it doesn't go as far as if you live in a rural community in the north. In Mexico, it's indexed. So what you see in Brazil, which is something I've also researched a lot, is that like city governments do piggyback programs. So Sao Paulo still has their own program, Rio has their own program, and you can legally, I don't have the figures here today, but I have a large amount of people that have 3 bank cards and are benefiting from 3 programs, and that's legal. Which also diminishes a bit the vote buying hypothesis, because often if you're very poor and you're receiving a program from the city of Sao Paulo, the state of Sao Paulo, and the government at the time under Lula, they're not all the same ideology or political party, so it's very difficult to see who you're going to vote for. But that, as I said, that goes quite into a detail. First of all, I just want to clarify, and you're right, I did a very broad view over those policy entrepreneurs. What I was trying to do is I'm not trying to refer to like the ideology of those specific people. I'm just trying to paint the picture that when you look at when CCTs, the idea was first circulating in Brazil in the 1980s, there was 2 very different ideas within the CCT framework. And those ideas, which one was more, I guess it would be better to say that, it's from a policy perspective that the idea behind renda minima was more left-wing. The economists and people that supported it were not left-wing. They simply had the wisdom that you're referring to, which was it worked better. It was unconditional. Everybody got it. It was universal. Go for it, right? It was very difficult to get political support for that backing because it was so, in a way, again, you think of like the economists that were working at it. How does a political party sell to Brazil, like Suplicy has been trying to sell for 20 years, that we should have a basic income program that everybody in Brazil gets, regardless of whether you're poor or not? So what I was trying to paint there was more not the ideology of the people who developed it, but when you look in the, like a broader development framework, the idea of the renda minimum without conditions was more embraced from a left-wing perspective, whereas the idea of really the conditions linked to it, that the bank would only give you money, the bank will only support you if it's linked to conditions, has to do with ideational processes which you can track and which you can trace back within the World Bank as an institution itself. And what I was also trying to do with the myth there, that I was trying to say the same thing you are, is that it's the idea of, is it part of an ongoing agenda to reduce poverty or not? And the fact of, is RCCTs a means to an end or an end in itself? And I wasn't trying to say that, the neoliberals are people from the right or institutions from the right that embrace it, that they're bad guys. What I was trying to say is that to them, it's an end in itself. The debate stops there. So when you said, what is the alternative? If you talk to people in Brazil that have been working in social assistance and working with SUAS, which is the Sistema Único de Assistência Social, and people that have been working specifically in social protection, they loathe Bolsa Family, not because it doesn't work, not because it doesn't reduce poverty, but because it's ended the debate. It's had this effect of, there's no more any ideas about improving educational attainment. Like, why aren't we talking about mandatory universal preschools? Why aren't we talking about putting money into that? Mexico is in the OECD, and so all OECD countries do it. Brazil is ahead with the Bolsa Family and the CCTs, but in terms of actual education reforms, basic ideas which are floating around in the OECD about universal preschool being regulated with programs. There's no debate for that. And so I guess what I was trying to say is the problem is that it's become this idea that for people on the left, they're okay with CCTs because it works. And in the words of Sonia Roca from IPEA, I hated it my whole career, but I've seen it has a real effect. It's a good first step, but it's got to be a first step. And what's happened is that the hype and the popularity, the fact that it's become the preferred policy instrument for leaving poverty in the developing world, like this lady mentioned in Bangladesh and India, and the work AusAid's doing. The problem is that part of the debates just ended. And I think that was what I was trying to highlight. But you are right. And when you go to the policy level, the debate is alive and well, and it's passionate, and it's huge. And it's fascinating to research, and it's interesting. When you go to the political level, the political games start coming, and it's my favorite quote, and I can't use it in another paper I published because I've used it way too many times. But Patras Ananias, when he was the mayor of Belo Horizonte, he had his own subnational program to alleviate poverty. It was successful and it worked. He then becomes the Minister of Social Development, and Bolsa Familia is his gig, and it's his, it's his claim to fame. And you sit down with him and you say, right, this came out of subnational experimentation, and there was variety in the programs when it was at the subnational level. You yourself implemented a program. If I am a mayor now, and I come up with an alternative program to alleviate poverty, but I don't have the funds to develop it, will you financially support? Can I go ahead and create a new program? And he looked at me and he says, as long as you can pay for it, you can do what you want. So yes, you get to the political level, the alternatives, it's become so centralized and such a central incentive that yes,